Hi, my name is Abby Ilavari, and this is my final project for INFM 645 Health Informatics Risk. We are going to be talking about, the PowerPoint actually is about Dr. X is a psychiatrist, and we are to be making a risk management report in regards to his visit to a skilled nursing facility. Content, I will be I have an introduction, risk assessment, risk evaluation, risk mitigation, risk analysis, appendix 1 and appendix 2. The appendix is about the risk management plan and the risk analysis, and then my reference. Risk. Risk is any situation that can lead to danger of a person or an organization. One can handle risk by avoidance, preventing the risk from happening, mitigating it, which is an action that can reduce the damage. Transferring, such as the risk of liability, can be transferred to an insurance company, like obtaining an insurance, and lastly, acceptance. A risk management plan shows one can handle a risk in any organization for any given situation. It contains assessment of risk, who will be responsible for the doing, and the frequency of the planning of the risk. There are several variations of risk, such as technical, financial, people, environment, and any other internal or external factors that can cause for a risk to occur. Risk assessment or identification. Risk assessment is to identify or assess the risk using a checklist of an event that can cause a potential risk, and the evaluation of a possibility that it might happen. The scenario that we were given, there were various risks that I could draw from that. Hypothetical speaking, there were information or data risk, electronic risk, security, remote access risk, and technology risk. Risk evaluation. Risk will be evaluated based on the probability that a risk event could likely occur and loss that would be associated with the risk. Like I said, the scenarios that we were presented, there were a couple of risks that we can draw from that. Information data risk. The transferring of sensitive information using electronic data interchange can cause unique information problem that will need techniques of risk analysis and solution program. Risk, if it gets into the wrong hands, could be a information data risk, such as the Dr. X, when he came into the skilled nursing facility, and he didn't have access to the EHR system, and he had to dictate, the data. Next is electronic risk. Unable to access the skilled nursing facility, like I said, EHR, Dr. S dictated his initial assessment via telephone to his house source offshore transcription service. The assessment is transcribed and posted to a secure web portal. So if a risk that can occur from that is if when he dictated that to what if it wasn't a secure web portal, that could be a potential risk right there if, it gets into the wrong hands. So that right there can be, a risk situation. Or let's say that when he was transcribing it in his home using, a non-secure web, that a non-secure system, that also can be like a risky situation right there. The security remote access rate. When Dr. S entered into the unit, he just showed an identification card. They didn't say it had his picture on it. They didn't say what detail it had it. So let's just say that it didn't have his picture on it. It was just a normal, ID, not even his driver license. I'm sure like a Dr. X, kind of identification, not saying he worked at this hospital or we know he's not an employee at the skilled nursing. So let's say, so anybody can just show up with an ID and they'll be given permission to go into the facility. That can pose a risk because anybody can come in, get data information on a patient, use it against them, and so that could be a potential risk, security and remote access risk. And lastly, technology risk. He didn't have access to their EHR system, so he had to log in his house to document whatever the visit was in there. Like I said, that also is a technology risk. So I did mean that he had information, he was able to log in from there, or he had an EHR system. Like, I know most doctors have like their own laptop where he can remote in, like use a VPN and document whatever he needed to do, or he can document it in his own office EHR system and then send an electronic, protected electronic documentation to the skill facility. So that could be a risk also. People can find a way to hack into the system and get whatever information that they need to do them for their risk mitigation. A risk mitigation plan is developed after the risk has been identified and evaluated. It is a plan that reduces the impact of an unexpected event. The project team can mitigate risk in several ways: by avoidance, sharing, reduction, or transferring of risk. In this scenario, the risk mitigation plan is developed as follows. Agreement for data sharing, so that the doctor in the skill facility should have some kind of agreement of data sharing according to rules and regulation of either both parties involved. There should be some kind of document to sign that the doctor can have data information and vice versa. Another one is setting out access and role management policy and practices for temporary or new access. This is intended to produce the policy and procedures needed for an effective implementation of selected security enhancement or access control of the policy. So Dr. X just used an ID to gain access to the skilled nursing. We don't know if it was there was a picture ID or it was just his name tag saying he was Dr. X or whatever. But I did mean that he was not a known physician there and it didn't have a picture ID on it. That can be also a security breach or an access breach, because anybody can just come into the facility without some kind of picture ID, just a regular ID saying that they're Dr. So-and-so and they're here to treat a particular patient. And, that could be a patient safety, and the data can be compromised that way also. So we want to have some kind of temporary access given to non-employee in that facility, whether it's a vendor or a doctor that's coming in to check one of his patients. We want to have some kind of temporary ID. They have to be validated from the security department before they can get into the building. And they have to have the validation identification stating that they're either a vendor or visiting doctor with a picture on it stating, their visit, and they have to be escorted by, someone. Another one is determine appropriate access to mental health records. We all know that mental health records is a touchy area. It is very important that appropriate access to mental health record be created, including the storage and how to actually maintain them according to legal principle requirement required principle. Basically, people that seek out mental treatment, they really, some majority of them are we want to keep it private. Any patient information should be kept private. This, some of them don't want the employer to know that they're getting some kind of mental help, or maybe some of their family members, or they just don't want people to see them that they're receiving some kind of mental treatment. So, we want to document this. We want to keep all their data. We want to keep everything confidential when it regards to any medical records, but mental health especially. The data can be misused for fraudulent activities. Someone can say, "Oh, I saw this person at this clinic, maybe a mental health clinic," and their friends might be like, "Well, was he getting treatment for mental health or something?" Stuff like that, or they don't want the employer to know. The result can also be a lawsuit for the facility involved if this information had gotten, out of the required area. Another one is securing unstructured, possible non-electronic patient data. Secure management of electronic medical information has an impact on the quality of patient care, patient right, and medical profession in their work practice, and the legal responsibility of it. When clinicians' access to data is delayed, the decision could be adversely impacting the care of the patient. So let's say the patient, the records wasn't available and the patient needed to be seen right away. The wrong medication can be given to the patient. One. Two, patient can be given some kind of medication that they're allergic to without looking in the system to see, what their allergies are. And one way that we can mitigate this is using a VPN to reduce this issue. So they can easily remote in to get data on this particular patient. And lastly, reliability of other entity, security, and privacy infrastructure. The maintenance of health organization privacy infrastructure is an important aspect. Temporary access should be given to medical professionals that are in direct care with the patient's care. The use of password protection by changing them so often and also using encrypted password could be used to mitigate this risk, because anyone can access data if it's not security protected, or if you happen to give your which should never be done, your password is someone or something, and or there's a hacker in the system that knows, oh, she uses 123 all the time. They can they can hack into the system and use that password, and they can get access. So regular password change requirements should be factored in, and also the use of encrypted password. Risk analysis. The review of risk connected with an event is the risk analysis. It can be added to the project or program. The technology, any actions really where risk can be analyzed on a quantitative and qualitative level. It is a component of risk management. In summarizing all the risks associated with the scenario that we were given about Dr. X, one can conclude that the risk in the situation is more of a security risk. From reading that scenario, hypothetical speaking, what I can derive from that is mostly a security risk can occur with that. So therefore, I summarize my analysis based on security risk. Password encrypted and identification and transferring of data all have the commonality of a security risk. So Dr. X sent the documentation to the skilled nursing facility via using an encryption. So, and the skilled facility wasn't able to access that. So given that he didn't use encryption to send the information, that information could have gotten into anybody to be used. Identification. Dr. X walked into the school facility showing his ID and he was allowed in. We don't know what kind of ID he showed, but even if he just showed any ID without it having been controlled, that it has to be a doctor that is already a speech ID one, or a doctor that is already registered in this system. Anyone can just walk in and pose to be a doctor and see patients. So that can, create identification risk. And then transferring of data. Also, he when he dictated his documentation, he sent it to an offshore vendor to transcribe it. So that also can become a risk. Let's say when he sent the data to the outsourcing vendor, he didn't send it in a securely web portal. That could pose to be a risk also if he didn't do that. So that's why I based my analysis on security risk. They all have that commonality. This is what my first appendix looked like. I kind of listed all the 5 mitigation that I got, the impact, the probability, the cost, the trigger point, the mitigation strategy, what type of risk or breach would it be, and then just a comment about it. So my first one was agreement for data sharing. Medium was the impact. The probability medium, I said it would cost about $75,000. The trigger point was that sharing skilled facility data with another facility, could be the trigger. Data was being shared with another facility, or the doctor in the skilled facility should have an agreement, that data can be shared. So it was like I said, mitigation strategy was data sharing agreement. The risk and ethical part was it could be a data breach if the information that was shared was misused. So that could be a data breach between the physician and the facility. The agreement for sharing data, my comment was that it protects the facility that is providing the data, ensuring that the data would not be misused, and it prevents miscommunication on the part of the provider of the data and the facility receiving the data, by making sure that any questions about data used are discussed between both parties. So I just kind of went down my 5 mitigation and just put them all in an appendix form. That was that. Then my second one was the risk factor, the impact description, the impact qualification, the probability, and the qualification, and then the priority. So it basically discussed the budget related, the duration, the projection, the functionality requirements, the impacts for the user, operation, technology, technical development, and technical requirements that are related to the scenario. And these are the references that I use, and that concludes my presentation for my final project for INFM 645. Thank you.